I think for me, the core values that have always remained the same for me are resilience, service, and kindness. I think no matter how far I've come in life and how much of I have achieved, I have always relied on the importance of being kind to others, to serving my community, and to overcoming after adversity. And I don't think that'll ever change for me, quite honestly. A moment when the weight of the world felt especially heavy, I would have to say, would be during the COVID pandemic. I am an emergency physician, so I am considered a frontline employee or a healthcare worker. And when COVID first hit in 2020, and it was so uncertain about the pandemic, we really didn't know what kind of virus it was, what it was going to do to the world, and what that meant for me personally, not only as a physician, but as a mother, and as a daughter, a wife, a sister. And so that probably was one of those pivotal moments in my life where I had to really make a choice, whether or not I was going to stand up and show up and serve a career that I've fought my entire life to become, which is a physician, and serve my community, or stay at home and wait it out just like everyone else. And so I made the difficult decision to go to work every single day during the pandemic. It was a challenging time. I remember being so uncertain about the virus and whether or not I contracted it while I was at work, or being overly cautious about washing my hands and wearing my mask. I remember I would go 12 hours at work and not even take my mask off, not eat or drink, because I was so afraid that I would bring something home to my family. Even coming home, I was overly cautious about even hugging or kissing my children, because I didn't want to potentially put them in a situation where I would give them a virus that we knew nothing really about. And so there were several months when I wasn't able to even do that or show affection toward my family. And I would say that was probably for me the most ultimate sacrifice for my career during COVID, especially being a Black physician, a physician of color, and seeing so many people in my community, other Black and brown people, that were dying at a higher rate than other races, was particularly hard for me to see and witness. And so for me, I felt it was important to do my part to try to save lives in that moment, and to reach my community the best that I could to try to get more people vaccinated. I think the communities that remind me the most of why my work matters are my students and my Made for Medicine program. They remind me every single day of why I do what I do. My children, for sure, Kendall, Jackson, and Ellis, they remind me every single day. But most importantly, I think it's my patients. When I have the unique opportunity to work in a community that looks like me, and I, as a physician of color, am able to reach patients and meet people where they are, where some physicians aren't able to. And so every day when I am able to have a candid conversation with a patient that looks like me, or provide medical advice, or give my opinion about the direction in which I think their health is going, and how I can help them get on a better track or get to a better health status, that reminds me of why I do what I do every single day. And so between my students, my own children, and my patients, it's a constant reminder about the importance of showing up every day, that I represent more than just myself every day I go to work. Every day that I'm given a platform like this to talk about what I do and share my experience with others, it reminds me that the life that I'm living is not just about me, it's about the people that I serve. I think the legacy that I'm building is one of which allows you to use yourself for a purpose that's greater than yourself. I say all the time that as a physician, I could have rode off into the sunset, had a great life, travel, do all the things that I wanted to do, but it was important for me to return to the same community in which I was raised, and to give back to the community that poured so much into me as a child and growing up. And so the legacy I hope to live is that we all can do so much more than just what it is that we've been blessed personally with. That it's important that we use those blessings for a purpose that's greater than yourself. And so Made for Medicine is a product of that. I wanted to see more physicians of color in our communities because the studies have shown that people of color tend to mistrust the healthcare system. It also has shown that people of color have worse health outcomes compared to other racial populations, are less likely to adhere to medical advice that physicians tell us because we're untrusting of whether or not that advice is correct. And so for me, I feel like if we can have more Black physicians or more physicians of color in our communities, then literally lives will be saved because of it. There's a rapport that you build when you walk into a room and you are automatically feel and understand that this person understands your walk of life. You feel seen and heard by the things that you're sharing, and you're more likely to adhere to the medical advice that they're giving you. And so if we have more physicians in our community that can connect with communities of color, lives will be saved and outcomes will be improved. So I wanted to create a program that allows students to see themselves in us. I wanted them to see other physicians of color who have become physicians and are practicing in Columbus. And I wanted them to be able to know in their hearts that they can become what we become. Many of us went to the same schools that they attend in Columbus City schools and graduated. And so we come from some of the similar communities that they grow up in. So we wanted to remove all barriers for them to be able to see themselves as a physician. So we support them from the time they're in the 7th grade until they graduate from high school. And my hope is that we can support them even beyond that when they go to college and in medical school, to continue to be a village for them to depend on and mentor them along the way. And it has been a privilege to teach our students, to watch them grow, to develop their minds. It's been a privilege to be able to teach them just a portion of the things that I've learned as a physician and hopefully capture their attention so that they will return to Columbus and practice medicine and be a beacon of light for our patients here in Columbus. So during COVID, what I learned about trust in healthcare is that people of color in particular have reasons not to trust the healthcare system. And so I wanted to make sure that I was a trusted voice during the pandemic. So I wanted to make sure that I was giving the community good, reliable information where they could make a educated decision about what they wanted to do about their healthcare. And so I wouldn't tell my patients, I wouldn't tell the community to do anything that I wouldn't do for myself or I wouldn't do for my own family or my own children. And so I wanted to make sure that I gave complete information to the community. People of color have a long-standing history of being untrustworthy of the medical field, whether we're talking about the Tuskegee Airmen experiment or Henrietta Lacks. Numerous examples to be skeptical about whether or not you're being told appropriate information. So I partnered with several other physicians of color in Columbus. We created Our Community versus COVID, which was a PSA video speaking directly to communities of color about the importance of getting vaccinated and about the importance of social distancing and washing your hands during the pandemic. And we wanted to make sure that these communities saw physicians that they know, that they trust, and that they would believe and that they would follow the instructions that we were giving them. And so we wanted to make sure that this was shared far and wide, and ultimately we were able to save lives during the pandemic. So I think we moved from conversations about health disparities to real outcomes of change, starting with yourself. I think we all need to look within in the healthcare field and see what it is that we can do to personally make a change in this space. Whether that is advocating for communities that have health disparities, whether it's investing in health equity and looking at communities and trying to make sure that people that do not have resources are given opportunities in the healthcare field to have their optimal level of health. by focusing on health equity initiatives and making sure that social determinants of health and all of those things are addressed during their healthcare journey when they're seeking care. And so I think if all of us as healthcare leaders, as physicians, as advocates and allies, if we focus on one part of health equity and disparities, we could see a huge difference in what healthcare outcomes could look like for not only communities of color, but poor people, for people that are food insecure, for people that have financial restraints and have challenges with transportation and access to care. The sky is the limit for the amount of change that we really truly could impact. So the work is worth it because the next generation depends on it. The next generation needs to have physicians who understand them, who are ready to fight for them, who will advocate for them, and who can be trusted by them. And so the work matters now, and we need to invest now on what our healthcare system is creating, what it stands for, what it fights for, what it values. Because the next generation of people, their life literally depends on it. You can support Made for Medicine by donating. We have a robust list of programming that we do for our students. We try to give them hands-on opportunities. We try to give them unique experiences to keep them engaged with medicine, and we can't do this work without the donations that we receive from our donors, but also from the community. And you can also volunteer. We love volunteers that want to spend their time with our students, that want to help us reach communities in which we do outreach to various schools in the Columbus area, do community events. So we're always looking for people to help us move our initiatives forward. But please donate.